back to the item. Ben, you and the team, we've had the PowerPoint presentation. Now I've got Councillor Dalton will move the item, and I need a second. I put in the Councillor Collins, but I haven't heard.
Happy to second, Chair.
Thank you, Councillor Collins. So look, that it's been moved and seconded, is now on the table. Ben, is there any further comments you and the team wish to make before I open up to any partai questions?
No, thank you, Mr. Chair.
Kapai. So look, I'm just going to open it up now for any partai. I've got Councillor Collins and then Councillor Cooper.
Thank you, Chair. Sorry, I was looking for the mute button. I just had one question, and it's in relation kind of the final points in the report, 37 through 39, and then touches, there's some indirect connections, and I think it's 42 and 45. I was just wondering if the officers are satisfied that given well, not the challenges, but that it's difficult to get every piece of data, and that they're satisfied that we're capturing enough or a satisfactory amount such that the reporting on how I Am Auckland is going gives us a really honest picture of where things are at the moment.
So, Councillor Collins, is that question in regards to I Am Auckland?
Yeah, sorry, am I on the wrong point?
Yeah.
I'm on 13. I beg your pardon, sorry, Chair.
No, that's all right. But if you had any partai with item 12, you're most welcome to ask any around the implementation of Awahi Kore Hapori Whanui.
Yes, I do, but I just need to change pages. So come back to me because I've got my pad on me. Hang on, Chair.
Yep, kapai. So, Councillor Cooper, item 12.
Right. It's around the vaping. Like I see that people, when they leave the website, are starting to look at, the opportunity of quitting or vaping. Are there any comments from staff around the either effectiveness of vaping or any more information about whether it's a good thing or a bad thing? Because there's still that debate, and we know that when we're debating the policy, we kind of left vaping there because we had a huge approach from the Pacific and Māori providers that it was a pathway to quit, even though we know that sometimes it's not the greatest for children to start or young people to start. Or is this out of scope for this? Please tell me if it is. I can go offline.
Good, I think that's within the scope of this piece of work, Councillor. So vaping is just one among the range of options that we're providing to people. So we're directing them to smoking cessation services that offer a range. So one of those is vaping. That's consistent with the resolution that you mentioned from 2019. And our work is based on the Ministry of Health's direction and the evidence. But our position is quite clear that we aren't, although we support smoking, vaping as one option that might work for some people, that it's not appropriate for children, young people or non-smokers. But we are continuing to work with the Health Promotion Agency, Hapai Te Horora, and Tala Pacifica to get those kind of messages out to children and young people about vaping being inappropriate for them. And we are continuing to work with the experts around making sure that we are up to date with the evidence and that the approach we're taking is consistent with that emergent evidence about the effectiveness of vaping.
Thank you.
Councillor Collins, you ready with the partai, your question?
Yes, Chair, thank you. Sorry, coming out of the page. I was looking at the diagram. Here it is. Wait, the diagram just around the Pacific smokers numbers, and just there's a couple of diagrams there. I'm just wondering if we feel confident that we're on our trajectory as such that it's that we've we're on track and that there's enough going on, especially around Māori and Pacific smokers, to bring those numbers down. I note in the report it says that we've got to reduce. There was a comment about having to reduce non-smokers, obvious, or new smokers to zero. So I just wanted to get a sense that we feel like we're on track towards those goals in an ambitious way.
Kia ora, thank you, Councillor. I'll make a couple of comments, and then I've got Rebecca Rufu-Cons with me who may want to add to those. So I guess from a positive point of view, the numbers are heading in the right direction. So both the proportion of Māori and Pacific smokers is going down, which is positive. But I think we need to do more. So we're heading in the right direction, but we need to keep on going. We need to build up some extra momentum. So that's partly what we're setting out in this report, is that we need to continue focusing on Māori and Pacific smokers. We need to focus in those areas that we've highlighted in the report, the priority communities that were in that we mentioned earlier on. So we're heading in the right direction, but we need to keep going, and we probably need to do some more. But I don't know whether, Rebecca, whether you have any extra comments.
Yes, thank you, Ben. I think our action plan of mobilising communities is really vital in this process, and I know that if we activate our community, especially our Pacific and our Māori communities, to take ownership potentially of the quit journey, but also smoke-free, the smoke-free kaupapa and environments, we should have a good amount of reduction in smoking prevalence. So as well as raising awareness of smoke-free, but we also want to encourage people to take on the quit journey. And in terms of our rangatahi, our youth, we don't want any child to take up smoking or vaping. So, we're currently working closely with organisations and schools regarding how do we get the youth to drive that message through to others and parents and schools. So I think we're on the right track to definitely get some good traction in helping people to quit and reducing those numbers for Smoke Free 2025 for Auckland. Kia ora.
Kia ora. And just one supplementary, if that's all right, Chair, and I'm happy to take this one offline, but I've got a particular interest in how for Māori and Pacific people, and this is in connection to point 35 of the report, how online and more so telephone services are useful for them. I'm just wondering, there's been some talk, especially around who's ringing Youthline and that kind of thing, and whether those are effective services for Māori and Pacific. So that's probably more operational, but I'd be interested to see how effective those types of services are for these priority groups. Thank you, Chair.
Yeah, whawhtai lava. Councillor Collins, matua Tony.
Yeah, just kia ora, Alf. Just a quick question, Ben. What's your intention, or are there any intentions to do any formal evaluation of some of these activities? It looks like you've had some good engagement. We had some good feedback, but is there any formal evaluation? I'm really interested in what's working, or what has worked, or what do you predict is working? That's the first question. The second question, and it's a little bit along the lines of, I think it was Councillor Cooper's question around what's in scope and what's out of scope, and obviously the pipe with meth as a form of smoking. Is that in scope here? And if so, is there any support for support groups coming?
Kia ora, thank you, member. So I'll tackle the second one, and then I'll pass over to Rebecca to deal with the first one. So meth and other drugs are outside of the scope of this piece of work. This is just purely smoking focused. And on this first one around our approach to evaluation, Rebecca will probably be able to answer that one for you.
Yes, we're currently engaging Auckland University at the moment regarding helping us to evaluate the OA Kore program. So that's still in the pipelines of going through to make it happen.
Yeah, thank you. It's the results, that's important here.
Yeah.
This is what's worked, what hasn't. Thank you.
Kapai, look, there's nothing in the chat box that I've been identified anyway for any more partai. So I'm just going to open it up for comments. And Ben, to you, Tara, Rebecca, and the staff, thank you so much. Now I'm just opening up for comments. It has been moved and seconded. So are there any comments before I put the recommendations? No. So look, Ben, to your team, thank you so much. And then as Renee Gaya would say, we're heading in the right direction. So I'm going to put the recommendation. All those in favour?
Aye.
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 Against? That is carried. Thank you.